Good afternoon, everyone. I'm here as a representative of WIKI Group 2. I'm representing WIKI Group's 2 combined efforts at putting together our position to advocate strongly for the use of smart cards. Smart cards in the field of telehealth will be a natural evolution in biomedical informatics. The advantages of smart cards are many, primarily to improve the outcomes of patient care. By inserting the smart card into a card reader, which connects to a computer, the data is displayed on the computer screen in any participating ambulance, emergency department, doctor's office, pharmacy, outpatient surgical facility, long-term care, or other health care facility. In an emergency department, the physician and staff will have immediate, detailed medical information. This will expedite a diagnosis of a condition and all the associated treatment that gets along with it. If for some reason the patient is unable to answer questions about their medical history, this will enable the team to have the information at their fingertips. Not only will this improve care for a patient, but will also improve patient flow and treatment decision processes in the ED. In the case of a physician's office, the card would enable the physician to have detailed medical information in a rapid amount of time, thus making a diagnosis even faster as well as treatment, and will increase the efficiency of patient flow in the office setting. To provide further support for smart cards, we also have the Path Forward, which is a organized, standardized, coordinated, and controlled information according to Ansehl 2011 for patients and providers. The report to the President realizing the full potential of health information technology to improve health care for Americans. The Path Forward, submitted by the President's Council of Advisors on Science and Technology in December 2010, proposes the potential benefits of integrating health information technology more completely into the healthcare system. And the smart card really is at the epicenter of all of this. Additional benefits for the smart card are that the cards conform to international standards which make them interoperable, stores large information for ready access. Access to information can be made available in areas where online access is not available, provides access and control of information, reduces, we believe, medical identity theft or fraud via the use of security elements such as a picture, a PIN, or biometrics, so that the card, if the card is lost, it can not be accessed by others, decreases medical errors and improves quality of care, relevant medical history, medication lists, allergy information, so it really promotes more safe and quality care. Reduces healthcare costs, streamlines administrative procedures for facilities, and may prevent duplication of tests and procedures. The smart card also improves medical records management. It speeds up claims reimbursement. It does improve privacy and confidentiality. There are encryption methods which will help keep information secure and private with availability only to authorized readers. Provides rapid information regardless of mental status, which is very important. Not all of our patients are good communicators of their health information, or location of the patient. From first responders to countries throughout Europe, information is readily available, even if the patient is unable to respond. There's pooled data for research, which we know research informs evidence-based practice. In essence, the smart card, it's really a dynamic process. Shortleaf really did a very comprehensive job of describing that, about the dynamic process of what healthcare technology, IT, and smart cards can do for us. I'd like to discuss some security measures that our group came up with. Provide a one contact number for individuals who lose cards or believe that the card may have been stolen. There are methods of authentication, including biometrics, fingerprints, passwords, physical credentials. Credentials could be issued to healthcare professionals by participating institutions for role-based authorizations, an audit mechanism for prevention of unauthorized people, and for people deleting or tampering with records. Once again, a secure PIN provides that one contact number for individuals who lose cards or believe that the card may have been stolen. Okay. From an ethical standpoint, ethical considerations or issues that may be encountered could be loss of anonymity, potential decrease of choice if most facilities move to smart card technology and individuals choose not to participate, reduction of access to services to those who are not techno-savvy or illiterate. These are some ethical considerations. There will be some potential invasion of privacy if safeguards are not followed. Tracking or profiling of individuals could occur without permission. Increased use could lead to a default national identity card without approval of the individuals. We know that there will be ethical issues, but we have to work on dealing with those ethical issues. And our group came up with some suggestions. Some of those suggestions are implementing the 10 criteria with Ansehl and Iodine from 1994 that were discussed in Shortleaf. We also talked about the creation of committees like an IRB that would safeguard these issues. I'm going to quote Shortleaf right now in saying, system valuation for information technology is presented as an ethical imperative. The big picture goal is presented as the creation of a system that serves the needs of its people in a responsible, ethical, and moral imperative. A system that protects the privacy and confidentiality benefits both individuals and society. Patients who know that their healthcare data will not be shared inappropriately are more comfortable disclosing to physicians. In conclusion, the use of smart cards for healthcare will ensure easier access to information when needed, provide security of the information, allow healthcare organizations to implement applications to improve access and ease of medical care, improve processes, decrease cost, and make healthcare a more cost-effective process. In the United States, the most advanced country in the world, our healthcare system still remains very broken and antiquated. A huge step forward would be the implementation of smart cards to move the access and efficiency of healthcare. That was one of the things our group discussed, how, and if you look on our wiki site, that one of our members in particular really did a great job of talking about some of the healthcare costs, and she went to other nations and she described and gave examples and she gave references on, where those, about, how they are controlling the smart cards, the costs, and how our nation sadly is lagging behind in some of this. Another important component I'd just like to bring in before we conclude is that using a smart card will actually empower patients to take charge of their health. This is a very important thing, that we begin to educate our population early. Just think of the possible creative opportunities if we start early, educating our children, just like it's such a thrill when you're a kid and you go out and you get your first bank account, Think about the kind of possibilities that we can have with healthcare so that we can build and we can empower a population for the future that will take charge of their health, that they will utilize the smart card and information technology to really promote the nation's health. We thank you very much for your time and attention in listening to this. Please visit our wiki posts on Group 2. Our group members did an excellent job of really approaching this from a very multi-pronged and dynamic standpoint. Thank you so much, and thank you to everybody for their efforts. Have a great day.